Hello, my name is Greg Madrid, and today I'm going to be talking about how we are currently using multiple systems to capture healthcare data at the world's largest healthcare company. I will explain the types of data that is being captured with the current state of affairs in the healthcare industry, and finally show you how we can unify this source data to improve the overall healthcare system. United Health Group's mission is to help people live healthier lives and to help make the health system work better for everyone. We seek to enhance the performance of the health system and improve the overall health and well-being of the people we serve and the communities. With a global presence in over 130 countries, United Health Group is divided into two primary divisions: United Healthcare, which focuses on the health benefits side, and Optum, which focuses on the health services. The healthcare industry changed from a patient-provider-driven model to a consumer-driven model based on quality measures and clinical outcomes, and there's a lot of potential to grow in this new model, with the key being to help providers meet quality measures. United Health Group generates its revenue from health services, premiums on risk adjustment products, managerial consulting, and the use of technology. However, companies such as Humana, Cigna, and Aetna all compete to provide the best services. The healthcare system in America is currently changing from Obamacare and 2008 Affordable Care Act initiatives. While the current administration's focus on repeal and replace effort may benefit United Health Group, the scrutiny surrounding the risk adjustment and quality measures to support Medicare and Medicaid requires accuracy. Being agile to conform to CMS's requirements is a must, but steering 270,000 employees to culturally change and share data towards a unified system is a challenge. Today, chronic diseases such as obesity, diabetes, and heart disease-related diseases plague our world. Many people suffer from multiple conditions known as comorbidities. Technology provides the tools necessary to track such conditions and help close gaps in care. Putting the right technology in place in the healthcare industry means meeting HIPAA compliance laws to protect patient privacy and limiting access to information, which has become more difficult with social media. The strength for UHG are its size and global presence. The company collects more healthcare due to the vast number of clients it provides in products and services. At the same time, the weakness is that the company uses multiple systems to collect this data, and the data is often not shared with other business entities. The multiple systems add up to multiple costs for which to maintain and support. The opportunity for UHG is to create a unified system and share data which will allow the company to create a more efficient process. This will also help reduce the duplication of work effort and resources, which will further reduce unnecessary costs. The current threat is that UHG tends to cause provider abrasion due to running multiple programs and systems. This creates confusion, which is a window of opportunity for competitors to provide better services through a unified system they can follow. UHG's problems stem from having multiple systems and a culture that currently doesn't share its data. Multiple programs and pilot projects often create their own database for their specific needs. This data, which could benefit other parts of the enterprise, is stored independently on shared drives. The separate divisions, mergers and acquisitions, and business entities support a divided culture that results in the communication silo. The proposed actionable business solution for UHG is to make every effort to store the data in a unified BI system that can easily be accessed anywhere in the world. The data must be inputted and accessible in real time in order to meet the demands of our clients. The proposed system evaluated is the Tableau BI solution that is supported by the Tableau Analytics Cloud. The biggest areas that will be impacted will be on the Optum Health Services side. The major task will be capturing accurate data that surrounds the quality measures and ensuring that both the architecture and infrastructure provide governance that allows historical data from the legacy and client HL7 systems to communicate. Our proposed timeline is to seek funding for the project in the budget in September and implement the system beginning in fiscal year 2018. The tentative deadline will have to integrate with Optum Health Services prior to CMS's annual updates in April 2018. Full integration throughout the UHG will follow onto United Healthcare Services side either in second or third quarter of 2019. The current capabilities for Optum is that some efforts have been made to implement a Tableau system from a previous pilot project. The system was even certified by NCQA, the organization that developed HEDIS measures, which is followed by 90% of the providers in this country, and it's a consumer-driven model that helps provide quality care standards. The required capabilities would be continued to build off of that system as we work towards an enterprise-wide unified system. The process would involve cultural changes, which involve a top-down approach. Communication efforts to stress the importance of the change, as well as the need for quality data, must be ingrained in the new culture. All end users must be identified and a training environment implemented to ensure a successful integration for both the new Tableau BI system and cloud-based analytics platform. Now, the primary sources of data revolve around the healthcare services, but the BI system must be able to collect from claim submissions data, health service delivery, and the HL7 data. careful planning must be met for proper governance to ensure quality data is obtained, and this includes having end users provide input for the data collection process. To better serve our clients' need, UHG needs to ensure that the data can immediately deliver data analysis and pattern recognition on medical documentation errors, as well as diagnosis trends. For documentation errors, it will provide UHG with the information to help provide close gaps in care, identify epidemics, and meet quality measures that will provide follow-up on the patients that suffer from chronic conditions. The techniques with which to deliver this information will be through a variety of reports, including geospatial population charts for diagnosis, scatter plot charts for identifying medical documentation errors, as well as trend analysis and reports to illustrate areas to improve in order to meet HEDIS and STAR measures and improve risk adjustment and quality care measures. Internally, data will help our programs monitor provider education programs and supply the data needed to support the RAF, HEDIS, and STAR measures. This data will be shared throughout the enterprise, so any programs entering a specific market area will have information for provider and member level data. This includes annual wall visits. These reports will help us produce better forecasts for pricing models of services and decision making for new programs. To support the Optum side of the business, 500 users, which will include analysts and key end users, will have access to Tableau BI system. The cost for supporting 500 users will be approximately $1.25 million the first year. The annual cost thereafter will be approximately $200,000. The additional annual cost for training, support, and maintenance will be approximately $58,500. The anticipated benefits of the Tableau BI system will be to provide accurate reporting for our clients in order to close gaps in care, meet HEDIS and STAR quality measures. The system will increase operational efficiency by 61%, provide more accurate reporting, forecasting, and mitigate duplication of work efforts. Overall, the anticipated ROI is a 32% increase in revenue over the next 5 years. In conclusion, United Health Group needs to unify its existing systems to improve overall efficiency, provide better service to its clients, and to help maintain a competitive advantage. By investing and integrating into a Tableau Analytics cloud-based platform with a Tableau BI system, UHG can better support its mission to help people live healthier lives and to help make the health system work better for everyone.